Welcome to Behind the Sports Medicine Podcast, the podcast that pulls back the curtain on the evolving world of sports science. I'm Andrew Rizza, an athlete trainer with decades of experience in professional, collegiate, and high school sports.
And I'm Cameron Roth, an orthopedic surgeon and a consultant for the Chicago White Sox.
In each episode, we'll explore the real-world challenges and opportunities facing today's human performance professionals.
Our hands-on experience is transforming sports medicine and breaking barriers through innovation and teamwork.
Hey everybody, welcome to this week's Behind the Sports Medicine Podcast. We're joined by Elly Hart, a physician assistant and certified athletic trainer at the Micheli Center for Sports Injury Prevention at Boston Children's Hospital. Elly specializes in the care of gymnasts and youth athletes and is widely recognized for her expertise in gymnastics medicine and injury prevention. Elly, welcome to the show.
Yeah, thank you so much for having me. I'm really excited to be here today and talk about my love of gymnastics medicine.
Thank you. This is great. We've been trying for a little while, and finally the stars aligned with all of our busy schedules.
They have.
You working very closely with gymnastics, and me in the athletic training world as well. This is Athletic Training Month, is March, so we're celebrating our profession here and the people that work with athletes. So, what a better place to be than talking about gymnastics medicine tonight.
Yeah, I love it. Happy Athletic Training Month to all those athletic trainers out there.
Can you tell us a little bit about your journey into sports medicine and what led you to specialize in gymnastics medicine?
Yeah, this is one of my favorite questions. So if you hadn't guessed it, by sort of hearing a little bit of my bio, I was a former gymnast. So I started at the age of 3 years old. And I actually not only did gymnastics, but also soccer as well. So I didn't specialize quite so early. And I loved the sport. It was everything that I could ever imagine, flying high through the air. There was so much hard work and determination that went into it, and a lot of long hours in the gym, which unfortunately led to a lot of injuries. And I was incredibly fortunate. I grew up in the area. I had great care here in Boston, but unfortunately, I really felt like no one really understood the sport. And so, for example, I would have a knee surgery, I'd get cleared to go back, and I would ask, okay, so can I go flip my vault, for example? And the provider would say, well, if you think you can, go for it. And like I said, I had phenomenal care, but no one really understood the sport. And so that kind of got me interested in sort of sports medicine. Then I actually went to James Madison, where I actually was a Division I college gymnast there. I started my career as also an athletic training student, did athletic training sports medicine. Then I graduated, practiced actually as my gym's athletic trainer, which was really exciting to give back to them. Then went on actually to PA school in Boston and heard of this gentleman named Dr. Lyle Micheli. And I said, who is this guy who does pediatric sports medicine? How have I not come across him? I'm from this area. All my care was through MGH, so that's how I didn't get to the children's system quite so early in my career. And I heard about how he founded pediatric sports medicine, and I said, when I graduate from PA school, that's who I want to work for. And I was fortunate by putting in all the hard work and determination, met Dr. Micheli, learned about his philosophy and practice, and said, I want to work for you. And it just so happened that the opportunity arose that I was actually his PA at the start of my career, which was incredible to be with the founder of pediatric sports medicine. And truly, that's where my career took off because, as probably most people know, Dr. Micheli saw a ton of gymnasts. And in his clinic, that's actually where this idea of gymnastics medicine started, because he, of course, is one of the founders of dance medicine. And so he would have these patients coming in who were gymnasts, and they would explain that they were doing something called a Yurchenko vault, which is where you run down the vault runway, flip onto the springboard by doing a cartwheel with your feet together, also known as a round off, then flip backwards onto the vaulting table, and then flip through the air. And most providers probably would kind of have their eyes roll back in their head saying, what language are you speaking? Mm-hmm. And I asked the gymnast, well, were you doing a tuck position, a pike position? Were you twisting through the air? And this gymnast's eyes lit up and said, you understand the sport. And so that's actually how this idea of gymnastics medicine got started, because a patient said, wow, you understand this, you get this, you've been in this sport. And so with actually the blessing and great support of Dr. Micheli, he kind of let us kick off this clinic that we now call gymnastics medicine, and this new field of sports medicine that's truly gymnastics specific. So I really owe a lot of my career to, the founding godfather of pediatric sports medicine, Dr. Micheli, because he believed in my dream, believed in this idea of a sport-specific clinic, and it's really taken off from there, which is fantastic.
Looking to get back in the game and feel your absolute best? Boston Orthopedics and Wellness has you covered. At Boston Orthopedics and Wellness, they're all about helping you recover faster, re-energize your body, and truly revitalize your health. Whether you're dealing with an injury, looking for cutting-edge recovery therapies, or exploring innovative treatments for orthopedic conditions, their expert team is ready to guide you every step of the way. From advanced regenerative treatments like PRP, stem cell therapy, and peptides, to performance and wellness services like NAD+ therapy, men's health optimization, and weight management programs, they offer a comprehensive, personalized approach to getting you back to peak performance. This isn't just treatment, it's a path to moving better, feeling stronger, and living pain-free. Boston Orthopedics and Wellness is where your comeback starts. Learn more and start your journey today at bostonorthopedicandwellness.com.
I got a chance to meet Dr. Micheli back when I started. I'm a little bit older than you. Over 30 years ago, I was hired by, him very well, Carl Gustafson, and Carl's a very big mentor of mine. He has been my whole career, and I still call on him for things. I ended up getting hired as the athletic trainer for Emmanuel College and Boston Latin School, and lo and behold, I met Dr. Micheli, which they were right up the street. They were our providers for sports medicine care, and then a young doctor by the name of Pierre Demacourt was my team physician. And it was pretty amazing because all these circles kind of align, and we got to meet all these people. And Dr. Micheli, even though I didn't have a lot of interaction, every time I went to a course he was doing or saw him, I said, "Hi, Dr. Micheli, Andrew Rizza. Oh, I know who you are. How you doing? How's everything?" Very nice, very cordial. And he was the guy that really worked hard at trying to perfect pediatric sports medicine. And they were the ones that really put spondy injuries on the map. They're the ones that figured it out and figured out the Boston brace and things that we'll probably talk about more later. But that was the start of all this sports medicine. And Carl always said to me, this is the group that helped shape this, that has made us better at what we do every day, which is phenomenal.
No. Yeah, couldn't agree more. And truly, he is my teacher. He is the guy who taught me how to do pediatric sports medicine. So I will forever and always be grateful for having. I actually got 3 full years with him as his PA before we really started branching into this gymnastics medicine. And I started having a more autonomous sports medicine clinic. But those 3 years with him were crazy exponential learning. And like you're saying, really a gift to be with the founder of this and just truly help shape what gymnastics medicine is, how I treat a patient, how I see a patient. So forever grateful to Dr. Micheli.
So as a physician assistant and a certified athlete trainer, how has your dual credentialing helped shape the way that you care for athletes? Is it more of the athlete trainer that comes out of you, or is it more the physician assistant, or is it, I guess, more the gymnast?
Yeah, I think we're a third split down on everything there, which I know is a little bit of a sort of an answer that maybe you don't want to hear, but it truly is a third, I think, each way, because truly for me, athletic training is where I learned my hands-on exam, my diagnostics, really even the injury prevention side of things, the holistic approach to a patient. That was my athletic training background of how I'm really approaching a patient and kind of going for it there. From a diagnostic standpoint of ordering x-rays, MRIs, prescribing medications, that's definitely the PA hat, and really fine-tuning what specifically is the diagnosis, definitely the PA hat there. And then lastly, kind of tying it all together of being a former gymnast, having a 20+ year career in the sport, still being involved today. I would say sort of, like I said, a third of each there. And definitely too, I tell everyone that my athletic training degree, I wouldn't trade it for the world. I think that was actually one of the best things I could have done before going to PA school. It really brought on the hours that I worked with the athletes, really honed in, like I said, on my clinical skills and my diagnostic skills for my physical exam. And also too, as you mentioned, I do work for USA Gymnastics. And so part of that is having that athletic training credential first, and then the PA credential second. And so for me, doing my medical coverage and on-site coverage for gymnastics events, I would say that's probably about 99% athletic training with the 1% of PA every now and then.
Now, how does your competitiveness being a gymnast help influence the way that you provide care to the injured athlete?
Yeah, definitely. Lots of competitive vibes over here. You can ask my older brother and all of my friends. But definitely being that high-level athlete, being a Division I college athlete, it's understanding that a lot of your identity is within the sport. And so I think, unfortunately, sometimes as clinicians, we forget about of course, being overall an athlete, right? And how you are in the gym, at least for gymnastics, probably 20 plus hours per week. That's where your friends are, your social circles. And that's also probably where a lot of your mental health, you feel better when you're in the gym and you're working out. And so sort of the competitive side of me is how can I get you back as safely and quickly as possible? And so I think I always approach a patient from that perspective, making sure that they understand that not only do we want what's best for them right now, but also what does the future look like for you in a year from now, 10 years from now, 20 years from now, and really making sure we're giving you that sort of sports medicine competitive edge to get you back safely and healthy as quickly as possible.
Yeah, and that's one of the things we talk about often with young athletes is we know you want to get back to competition. We know it's your identity, but we're also looking out for a future, right? So if we have that athlete that has that injury that is undiagnosed or isn't properly assessed, then they could then create more damage down the road, which when they're 20, 25, 30, now they're starting to see, a little bit more aggressive arthritic changes, biomechanical changes, and all that other stuff just starts to unfold and unwind like peeling back an onion. So it's important to have that background as an athlete, but also as an athletic trainer, seeing the acute sides of it, but then also you, like you said, with a diagnostic brain as a PA, like looking at that and saying, well, this is what I think we need to do in order to make sure you're safe getting back on the gymnastics mat.
Yeah, it's true. And I will say a lot of students and even former patients have asked, hey, what was your path? How did you get to where you are? Would you change anything? Would you do anything differently? And I'll be honest, I feel incredibly fortunate to say that first, having that athletic training degree was so important to my PA career. And I actually encourage a lot of the sort of future pre-PAs or even MDs as well as actually doing athletic training first to get that hands-on experience and really be a part of that athletic community, because I think it was a huge stepping stone and a huge portion to how I got to where I am today.
That's fantastic. And you couldn't have said it better. I think that's one of the things that a lot of the docs we work with, they've experienced that acute care. They're on the sidelines. They're kind of growing themselves as like an acute care specialist versus just seeing somebody in a controlled environment, right? So it's definitely important. Now we look at understanding gymnastics and what people might need to know about it. We talk about age groups and loads and things that happen over time. At what ages do gymnasts typically begin experiencing high training loads, and how does that affect their injury risk?
Yeah, a really good question. And I think one of the most important things to first talk about before we even get into that portion would probably be sort of age of start of gymnastics and sport specialization, because I think that's key to understanding the sport of gymnastics. So most young gymnasts are starting at the age actually of like 3 or 4 years old, and their first competition is somewhere around age 6 or 7. So we are starting early, we are pounding early, we are all having open great growth plates at that time. So I think that's the first and foremost thing just to start thinking about is when do you start competing? Because when we think of load and volume, really it's at such a very young age. Now, traditionally, though, when we do start to see those overuse injuries from coming in, it's typically around age 10 or so. I think the tricky part is more and more studies are starting to come out about gymnastics injuries, load, volume, and training, but there's definitely not enough right now, and especially not enough prospective studies. So really kind of what I'm commenting on is sort of my clinic volume and I've been seeing over these past 11 years. And so I would say my sort of first age of where we're really seeing the repetitive overuse is starting around age 10, but usually maybe even up until 13 or 14. But I have yet to meet a gymnast who has not had an overuse injury before, or I should say after the age of 14. So usually they're all coming in between that 10 to 14 age group for repetitive stress, repetitive injuries that are happening. Now, when I think about that, the other thing that's important to know about gymnastics, there's different levels in our system. So the lower levels, of course, have less volume, less training, less competitions. The higher levels have more volume, more training, more competition, more intensity. And research has shown that, of course, at the highest level of gymnastics, that's your highest risk of injury versus your lowest level. But when we think overall about gymnastics, the number one injury is actually an ankle sprain, followed by knee internal derangement. So things like meniscus tears and ACL tears. So when I'm thinking kind of big picture about load and volume, I think the important things to know would be first, how old are they? Second, what level are they competing in? And then third, how many hours are they training per week? And are they just doing gymnastics? I think that definitely changes a little bit of your injury profile.
I'm glad you framed it that way with injury, different age groups when they start, fascial plates being open, the amount of pounding that happens, the training, the repetition, and the volume. we look at this in baseball with throwers. And we had interviewed Dr. James Andrews several months ago, and we talked about USA pitching rules and how they were the ones, the Andrews Institute with him and Major League Baseball, they kind of got together and they put this pitch rules together, and we see it now with youth athletes. Is there a criteria for gymnasts to start doing certain types of training, certain type of vaulting, jumping off the beams? Is there something that USA Gymnastics has put together to make sure these athletes are safe?
Yeah, amazing question. And I wish that I could tell you that, yes, that was in place. Unfortunately, the only current rules, particularly thinking of women's gymnastics, so women's artistic gymnastics, there also are many different versions of gymnastics that we can go into as well if you have questions. But women's artistic gymnastics, for example, your Simone Biles, your Carrie Strug, your Nastia Liukin, kind of the hot names that you would know there, they do not have any sort of pitch count, or we'll call it gymnastic skill count. Really, the only big thing is we have age brackets for what's called our junior elites and our senior elites. So to be a junior elite gymnast, you have to be between the ages of 13 and 15, but to be a senior elite gymnast, it's 16 and above. And now when we think of what's called the code of points, so meaning what skills they're doing to get scores, it does vary based off of your age. However, the really interesting part about gymnastics is female gymnasts can actually do, and I hate to admit it out loud, any skill at any age at any time. The only rule that really stops them for competing is actually their age and their level. However, you're allowed to start competing at the age of 6. And again, to be a junior elite, usually it's typically age 13. However, there have been kids who have been 12 that are junior elite. So you can imagine a junior elite is probably doing somewhere between 30 and 40 hours a week of gymnastics at a young age of 12. We also have a younger system that's called our HOPES system, and those kids can between ages 10 and 13. So unfortunately, we do not have some of those restrictions that I actually do think would be imperative and important. And I would love to do a study on, for example, extension counts, right? So how do we prevent a spondy from happening? I think the tricky part about gymnastics, unlike baseball, they are doing one movement over and over again with repetitive throwing. In gymnastics, yes, you could say there's a lot of arching and extension, but I think there's different versions of it. There's different skills that you're doing. And sort of unlike the way that you would necessarily maybe pitch a baseball, in gymnastics, there's actually different techniques and different ways that you can do certain skills, as well as based off of the athlete, you can pick what skills are going in the routine for certain levels. So I think it's a little hard and a little difficult to try to come up with a extension count or arch count, but also I'd love to see the research and try to do that type of study. I think another hard part about gymnastics is that we are moving in the right direction of trying to do studies and understand what is leading to injury. But I think the trouble is that, to be totally honest, our team is doing so great. We have won so many Olympic Games, so a lot of coaches don't want to change the way that they're coaching because it's successful, right? It's creating an Olympic athlete. But my big question is, how many athletes did you lose to get that one athlete? And what are those athletes who didn't make it to the Olympics? How are they doing? How are their bodies? How are they recovering? And I think we need to take a bigger approach to the whole sport of gymnastics versus those 5 young women and 5 men who make it to our Olympic team.
And I think the one thing that kind of popped in my head as you were saying that was that, what do you need to do in order to get to that point of saying we should not be doing 40 hours a week? It should be 20 hours a week because, we have these regulations in swimming. We have them in baseball. Like, what is some of the research showing with, athletes when they start to see bone failure or, like you said, internal knee derangements? Mm-hmm. And those things are acute and they're more twisting type injuries, but how much compression, how much extension, and how do you monitor it? Do you think there's a possibility with the advancements in technology and AI and machine learning that we could look at gymnasts in that way to be able to see how much Newton force meters are being produced with extension, how many Newton force meters are being produced on a landing off a vault? Mm-hmm. Do you think that's what medicine is going to start looking at? And is that something that they may be even doing at this point in time?
Yeah, no, amazing question and love where your head's at. And that is exactly what I'm thinking too, because the way prior to AI to do this type of study would be me sitting in a gym, watching one kid and counting how many skills he or she did. And
Right.
I'll be honest, I asked Boston Children's if I could take the time to do that, and I got a big stinking no. Because that would take quite some time. That's a lot of
Right.
time out of clinic. And in terms of sort of sitting in a gym, that is really one person sitting there and counting. So I actually think that the AI systems that are coming out right now actually are going to be incredibly helpful to really actually answer this question. Because if AI can follow a gymnast and count how many hyperextensions or landings or impacts or poundings are happening, and then athletes are filling out surveys saying this hurts, this doesn't hurt, or I had to see a provider, or I didn't have to see a provider, I do think that's going to be key to actually solving this mystery. And something that I love to tell my patients, and I'm sure coaches out there don't love to hear this, I actually only did 16 hours a week of gymnastics, which I know sounds crazy to some people because people say, what, only 16? That's a high number.
Yeah.
But I did 16. My teammates were doing upwards of 20 to roughly 30 hours a week of practice at the same exact level. I just had a mom who said, my kid is exhausted. She needs to rest. She needs to sleep. She has to do her physical therapy. She needs to not be in the gym so much. So we're going to only have her do 16 hours. And my coach didn't love it at first. However, I was still able to be an incredibly successful gymnast, so meaning I did our highest level of level 10. I did Division I college gymnastics and was a very successful athlete. And I really attribute to not being in the gym that much a lot of my success. And I think that that's a really big statement coming not only from a medical provider, but a former high-level gymnast, is that I didn't have to be in the gym as much as my teammates were. And I do think that actually helped me reduce my risk of injury significantly. And in my own clinic, I talk to gymnasts about, what are you doing outside the gym to recover? Are you sleeping at least over 8 hours? Are you drinking plenty of water throughout the day? Are you having breakfast and lunch and pre-gymnastics dinner and post-gymnastics dinner and fueling your body properly? How are your stress levels, right? So I think there's so many things that we could do outside of the gym that would help us be not only better gymnasts, but better athletes in general. And now with the AI systems, I think that can be all tracked way easier than putting me in a gym and counting or asking my questions. So I'm really excited for the future to see what these models might show, because I think we can probably make some counts or recommendations and better guide our coaches, our athletes, and our parents, and even our medical colleagues on what we should be recommending. Because right now we're still a little bit in the wild, wild west of like, I'm not exactly sure, but let's try this or let's try that. So I'm excited for the future with AI.
You know, it is interesting. I was talking to Dr. Mean about this when I had talked to him several months ago, actually probably a little over a year ago about this. And, you know, using wearables like Oura Rings or Whoop is another device that a lot of people know about because they're based out of Boston.
Yep.
And I talk to young athletes all the time about their sleep, their cognitive function, how they're doing with nutrition, how we reduce injury risk on a field if they're playing, for instance, soccer, where an average soccer player is running 7 to 9 miles in a competition. So where you're getting your rest and recovery, and if we can mitigate the risk by reducing the amount of impact during the day, they're going to be better performers. And I think back to, 10 or 15 years ago, maybe even longer than that, I was with Carl in the clinic and we had an athlete come in that was a marathoner. And it was probably 8 or 10 weeks before the marathon. And he looked straight at the marathon runner, this gentleman, and said, you are not going to touch the pavement until the marathon. We're going to get you on the elliptical. We're going to start doing strength training. We're going to get you to reduce your injury risk because right now you have pain. And the guy looked at him like he was nuts. The guy came back after the marathon and he goes, you wouldn't believe it. I ran my best marathon that I've ever run. And I doubted you until I got out on the course and I felt great. So it proves that if you do have, and it's not for everybody, but you made a great point. Like you were training 16 hours a week and that worked for you, but it may not work for athlete B, right? So you have to kind of know your athlete, know yourself, know the people you're dealing with, and then make the right clinical decision that's in their best interest. So if you look at injuries in general for gymnastics, where do you see the most common injuries and at what age group? And then if those go undiagnosed or unrecognized, how do you manage that? Like, where does that kind of thought process go when you're assessing? And then if they're missed, are you seeing some of those that are getting to you at Children's, and how do you deal with them?
Yeah, really good question. So first, I'll give you my researcher hat answer of what the research is telling you about the most common injuries, and then I'll put on my clinical gymnastics medicine hat that I'm seeing in clinic there, because they're two different answers, I'll be honest with you. So again, research will tell you most common injury is an inversion ankle sprain, followed by that knee internal derangement, and then there's like a third place split between low back pain, wrist pain, elbow pain, heel pain, knee pain. Like there's sort of like a split in third place. And that's sort of what the research says. Now, specifically in my clinic, I would say 50% of my patients are coming in with back pain. And of that 50%, unfortunately, the next 50% are having a spondy or spondylolysis. So repetitive stress injury to the pars interarticularis from repetitively arching backwards. It makes sense. It is a sport where you are constantly arching. Kids are growing and developing during this time. And what's interesting is the age group of where I'm really most commonly seeing this is roughly the ages of 12 to 15. So I do think that's quite a wide range because a lot of these young athletes, they're prepubescent and not postpubescent. And my 15-year-olds tend to look a little bit younger. So I would still put them in the prepubescent category, despite the fact that we would think 15, 16 will be more sort of post-puberty, if you will. And I think the other key point to talk about with gymnasts is sometimes they are having puberty later than other athletes. So I think my 12 to 15 sort of in general age group does seem like quite a wide range, but usually they're all prepubescent during that time. And I would say that is a huge portion of my clinic that I'm seeing is this extension-based back pain from a spondy or spondylolysis. Now, unfortunately, as you mentioned, sometimes these kids are continuing to push through, and so we're not seeing them until maybe they are 17, 18, 19. I do even see collegiate athletes as well. And sort of what I get told by the patient is, well, I've had this back pain for 2 or 3 years, but I didn't want to see anyone because I was getting recruited for college or I had a big competition coming up. It went away, it was fine, and now it's back. Unfortunately, those spondies that are being missed at the younger age are sometimes turning into a chronic fracture, as well as unfortunately turning into the spondylolisthesis, so meaning the bilateral fracture with slippage or moving forward, which is then unfortunately presenting with, for example, numbness and tingling down one leg because now it's pressing on a nerve root. So in those cases, we do want to catch these spondies early. So I do tell patients, parents, and medical providers that extension-based back pain, not only in gymnasts, but pediatric athletes, is not normal, and it needs to be worked up, and you need to have a diagnosis. Really meaning that you have to understand what is causing the pain. It is not normal for any gymnast to have, or even athlete, to have extension-based back pain that's ongoing and lingering that hasn't been worked up. To me, that's an unacceptable amount of care. We need to understand what's happening, and thinking of adult back pain, we start initially with go to physical therapy, right? But with kids, I think that we really have to hone in, particularly, especially with those arching extension-based sports like gymnasts, because I am seeing probably 50+% of them with extension-based back pain are spondies. And so if we don't address these, if we don't understand them, if we don't treat them, I do think that they turn into really bad repercussions, not only as adults, but even as just adolescents and older teenagers. And so I do think that it's imperative that we do work it up. In terms of spondy, you actually talked about the bob brace that Dr. Micheli created, the Boston overlap brace. And what's been, I think, the most rewarding thing in my career is we are actually now looking back on my sort of results for having my spondy protocol. It is a very long protocol. So I'm going to say the number out loud. Everyone's going to eye roll or sort of not love it. But it's a 3-phase protocol that does take about 16 weeks to complete, 16 to 18 weeks to complete, okay? And I'm going to talk about it briefly because I think it's important, because right now we're retrospectively looking on the data set of how many kids we have actually healed with their spondy. So not just pain-free and back to sports, but actually healed a fracture or reduced the edema that was in the bone from this protocol, which the results are coming in, and I am astounded and excited to sort of get this paper out there shortly. But what we do is we put them in the bob brace, so Boston overlap brace, for 6 weeks, remove them from the sport of gymnastics, but I have them start physical therapy right away. To me, that's really important that we're doing that. From that position, it keeps them in a straight position, doesn't allow them to extend backwards. The first 6 weeks are the hardest. During that time, I'm also telling them to get 9-10 hours of sleep, increase your calcium and vitamin D. We are trying to heal this bone that's there. After those 6 weeks, you come back in. I then do your physical exam. I actually have a little gymnastics gym, so I actually have them do some skills in the office. If they're doing well, they actually transition to something called a warm and form brace. So that's the brace that would wrap around but has a hard piece in the back. That hard piece in the back does prevent arching or extension, not as well as the bob brace. And I actually let my gymnasts do some gymnastics. It's very restricted, but some gymnastics for the next 6 weeks. It's not arching and extension. It's not full gymnastics, but it's a reintroduction with the idea of getting back into the sport, building your muscle, but not extending or loading the spine. And that's for another 6 weeks. And then the last 6 weeks you come back in. I actually do get an MRI, which I know is also controversial because you are not supposed to get an MRI per the spine criteria. However, I mentioned these athletes are between the ages of 12 and 15. So I want to know, did we heal this or didn't we heal this? Because this could have repercussions later in life, or maybe there are certain skills we should not be doing. And so I do this MRI to look to see, did we have healing? And if we do have full bony healing as well as less edema in the bone or no edema in the bone, we go to phase 3, which is getting out of all of the braces and actually progressing back to full gymnastics. And right now, I can't give you an exact statistic because they haven't come in, but just eyeballing it, we have had an incredibly high success rate of not only being pain-free back to full gymnastics, but healing these fractures that people said you couldn't heal. And so I really think that sort of having that sport-specific gymnastics plan, and like I said, it's a 16 to 8 week plan, so it is a commitment. We're doing physical therapy all throughout it, but having that specific plan has shown incredible results. And now looking, because we're in year 11 actually now, looking at this, I have not, at least at this point in time, had any repeat people come back with a worse spondy or worse fracture later on. So outcomes have been fantastic with this protocol. So with that specific type of injury, to me, it's just so rewarding to see how amazing these athletes are doing, but also how sport specific this protocol really is. And I think I wouldn't be able to do that without athletic training, PA, gymnastics, and Dr. Micheli, to be honest with you.
Yeah. That's pretty amazing. And, one thing that I was thinking about is you were mentioning the protocol and how many weeks it was. Mm-hmm. What is the conversation to that athletic trainer that's examining, or even a parent or an athlete that's afraid to be examined? Yeah. What, at that age, if you don't have the examination and come up with a differential or actually a true diagnosis and assessment, what can happen down the road with that athlete? Can you explain that?
Yeah, so as we know, the younger you are, the faster your bones are turning over and changing and actually able to heal. So if we do catch this at an earlier age, I think that's probably also why my results are pretty good, is that their bones are turning over and healing faster than someone who is 17, 18, 19, 20 years old. So for those athletes who are nervous to come in to have their exam or are maybe ignoring their pain, my concern is that this will turn into a chronic fracture and that we will not have good healing rates. And then this turns into chronic back pain. And in sort of some of the most worse and severe cases, may even prevent you from doing the sport that you love. We can understand that gymnastics has a lot of arching and extension. So if your back isn't able to do that, unfortunately, you may need to medically retire from that sport. So I just really encourage all these athletes to come in if they are having back pain, because again, to me, that is not normal in any sport, in any athlete, particularly with gymnastics, because it should not be back pain with doing that sport. So I think it's imperative that they do come in, and again, if it's not treated, it can turn into chronic fractures, lifelong back pain, and inability to participate in the sport that you love.
Yeah, that's fantastic. And we try to tell athletes this all the time. Our goal isn't to keep you off the field or off the court or out of the gym. Yep. It's to prevent things from getting worse, because, I mean, you're going to get injured doing your sport, most likely. It's very rare that you see somebody that doesn't have an injury. Yep. So I think it's important to make sure you're giving them all the facts, talking about outcomes, how we can get you better, how we'll prevent this later down the road. And if we can do that, we're doing a great job every day. So it's important, I think.
For sure, definitely. And I think the same is true when I think of the other sort of 50% of my patients who are coming in. I think it's a split between upper and lower extremity injuries. Now, particularly with gymnastics, there's something called gymnast wrist, or repetitive physeal stress injury to the distal radial growth plate. So from repetitively pounding and impacting on a wrist with open growth plates, it causes the distal radius to have an injury. Kind of similar to sort of a stress fracture, only it's more of a stress fracture to the growth plate. This age group is somewhere between, and this is again crazy ranges, so I always hate when people ask for age ranges when I'm talking about gymnasts, because I think we're a little bit of a different breed in terms of what the normal outcome would be. They could be as young as 8 years old, but as old as possibly 15 years old to present with gymnast wrist.
And what are some of the signs and symptoms that differentiate those from a scaphoid fracture, or even something that could be along the lines of maybe a TFCC injury?
They would present, again, with distal radial physis pain, so thumb-sided wrist pain. They would have limited wrist extension. They would have pain with weight bearing and wrist extension, so think of skills like handstands or back handsprings or vaulting, so that pounding and impacting, causing a repetitive shearing force and injury to the growth plate. And I think something that's really important for clinicians to hear is, even if you do an x-ray and say the x-ray is deemed normal, you can actually still have gymnast wrist. So if the athlete has pain to palpate, on their distal radial physis, limited wrist extension, and pain with weight bearing, you actually do not have to have x-ray criteria. That's actually a stage 1 gymnast wrist. And a lot of the times, unfortunately, I am getting these gymnasts at a stage 2 or 3 gymnast wrist because sort of they went in, someone said, hey, it's a wrist sprain, your x-rays look normal. But I think it's important to remember that a Salter-Harris 1 x-ray does look normal. And so I think we need to really treat these gymnasts specifically by resting and immobilizing the wrist. And I think the unique thing about gymnastics medicine is it's that, yes, we want to rest the wrist, but you can also be in the gym still. So you can do lower body gymnastics, core strengthening, you could do back strengthening, skills that don't involve the arms, even if you're resting your wrist. So I think the unique part about gymnast wrist is, yes, we need to rest it so it doesn't turn into a more severe stage. But you could be in the gym actually doing some gymnastics that doesn't involve the wrist to keep your body in shape and also keep you up to date with some skills and maybe work on some other things while you're healing. But I do think it's important that clinicians do hear that a normal wrist x-ray, but with all those other symptoms that we just described, does not mean you don't have gymnast wrist. And one other sort of unfortunate sequelae of gymnast wrist is if it is ignored, the distal radial physis can actually close early, and then the ulnar physis stays open and leads to something called ulnar positive variance, which unfortunately then can lead to wrist pain as an adult. It's now pinky-sided wrist pain, can lead to a TFCC tear, and a lot of chronic wrist pain as an adult, and also decreased function actually of the wrist as an adult. So this is something that we do want to take seriously. We do want to continue to monitor and make sure that clinicians are definitely aware of it.
No, that's fantastic. And, we talked, about training load. We talked about overuse injuries. We talk about these things, and you're looking at year-round specialization in sport and impact injury risks. And how do we change this? And is there actually a time frame that these gymnasts should be resting or taking time off? Because the reason why I ask that is that we have, say, track athletes, for instance, that start cross-country season. They go right into indoor season. They go right into outdoor season. We're trying to get them to take 2 to 3 weeks to get in through recovery. Is there a timetable in gymnastics where you have a fall, winter, spring, or a summer, and you say, we're going to just shut you down for 3 weeks to recover, and then we'll pick it back up again? Or are they straight through not taking a break?
Yeah, really good question. And we do actually have a season. So yes, we train year round, but there is more ebbs and flows, which is actually really good. And is definitely a change to, I think, even when I was a gymnast. So technically speaking, the competitive season, at least in the New England region, so it's a little different throughout the United States, but we'll speak specifically about New England, usually starts around November. So from November till about May is your competitive season. And as you get closer to May, those are when the competitions become things like our state meet or our regional meet or our national meet. So the more important competitions are later in the season in the springtime. Then over the summer, that's where you're actually working a lot of your upgrades, so meaning harder skills. But what's really interesting is you're doing more drills, you're landing in foam pits, softer mats, having more of a spot. So I would actually say when you finish your season in May, that could be a really great time to let the body rest and reset before you go into your summer workouts and your summer training that would then start right as school kind of ends. And then you sort of pick back up, start learning more of your routines and what I would say late summer, early fall, and then the competitive season again starts in that Thanksgiving timeframe. So I do actually think that more gymnasts are actually now taking advantage of that, which is fantastic. So I think we are having a little bit, if you will, more of an off season. Now, do I wish it was probably more than 1 week? And do I wish that it was maybe a little more spread out? I think that's probably true. Mm-hmm. But back in my day, there was, well, I'll put it this way, my teammates didn't have any vacations, but my parents believed in taking me out for 3 weeks during the summer. So I was on family vacation, living my best life, surfing and doing other things. So I was very fortunate to have that time off, but not everyone was back in the day. I do think now, though, it's becoming a little bit more mainstream to take a week or two off, kind of when your season does end. So I will say we're getting better about the periodization and ebbing and flowing of our practice schedule. Still not perfect, but I think we could probably better guide our gymnasts by saying, hey, let's take this week to have a rest, or let's take this week to deload. And I just think the coaches are, being asked a lot. They're being their coach, their sports nutritionist, their mental health provider, sometimes their sports medicine doc, right? And now we're adding on periodization too. So trying to help those coaches with the schedule, I think, could also be really helpful for our athletes in preventing injuries as well.
Yeah, fantastic. And we're tying this into like injury prevention here. So, one of the things that we talk a lot about is strength conditioning specializations. And are there any programs that are critical for your injury reduction that you like? Or is it just, let's get in the gym, let's do core stabilization, let's do upper extremity stabilization through lower body. Is there a go-to that you like to use for your athletes?
Yeah, amazing question. And I think the first thing I'll say is I wish I could give you a one-size-fits-all recommendation. And I think kind of a really unique part about gymnastics, and also why we haven't had our extension counts or pitch counts, if you will, is because gymnasts are actually built all a little bit slightly different. And there might be slightly skills that are different for certain kids. So for example, I don't know if anyone's familiar with Nastila, but she is a very tall, well, I shouldn't say very tall, tall for a gymnast. She's 5'5" for her height. And she was very slender, but she was amazing at bars and balance beam. And then we have Simone Biles, who is just under 5 feet. She is incredibly muscular, and she is not only
Very
fantastic
powerful.
at every event,
Yeah.
exactly, she's fantastic at every event, but in particular, I would say floor and vault are probably her two powerhouse events, right? So the prescription that I would give for injury prevention for Nastila with that slender, tall, more bars and beam athlete would maybe be a little bit more of building more muscle bulk, right? More strength, stabilizing her joints, versus maybe someone like Simone, be more of a focus on flexibility, making sure that we're having enough recovery, deloading of pounding and impacting. And so I think what's really hard about the sport is everyone is a little bit different. Now, generally speaking, I think one of the best things, if I could tell, for injury prevention for gymnasts is actually working on your deep core muscles. So not those rectus abdominis aesthetically pleasing muscles, but the deep core that helps hold everything in, because a lot of gymnasts actually hold their breath when they do different skills. So they're actually not activating that deep core and really relying on hip flexor strength and actually momentum to do the skill. So when I test my athletes actually in clinic on their core strength, even just a simple single leg glute bridge, for example, that someone would say, well, that's testing glutes, not core. You see that core drop instantly when they lift their leg up. And so to me, that's actually one of my favorite tests to do, because it's not gymnastic specific, but it's a great way to say, can you actually activate that deep core muscle? So I think that would be one of the main things to focus on there. And then you touched upon that joint stability. So gymnasts have a lot of hypermobility to their joints, but not a lot of stability to their joints. So I do think focusing on that. And then the last thing would be probably thoracic movement or periscapular strengthening, because so many gymnasts are taught this hollow body round position. And again, you're not engaging the core muscles, you're rounded forward, you're in sort of the Hulk position, if you will. And so really focusing on well-balanced symmetry of that upper back and mobility, I think if you focused on those three things, it would be key to help prevent injuries.
Well, you just made me happy, because those are the three things that we all talk about. First, lip breathing with exercise, single leg bridge without dropping your contralateral hip or isolateral hip, and then doing thoracic extension, because we get athletes that are bent over all day looking at their computer or their phone, and we put them on a roller to do extension, and they basically think that somebody's trying to stab them. They can't get the extension. But when they're done, they feel fantastic. And then we do mobility and cupping, and we'll do floss band, like voodoo bands for mobility, and that stuff helps them a ton. And once they get that type of treatment, they're like, whoa, this is like next level. Like they understand that this is important for their well-being. So that's fantastic. So we touched upon a ton of stuff. I have a couple other questions. I know you have a lot going on. And then we have this lightning round we do, which is awesome, because they're like one-hitter questions, and these are great when we do these. So gymnastics has gained attention regarding athlete well-being. What role do sports medicine professionals play, athlete trainers, physician assistants, orthopedics, everybody in the care model? How do we support athletes' mental health? And is that a big focus for you in your practice? And how do you build that into helping your athletes make sure that they're getting what they need?
Yeah, awesome question. And I'm so glad you brought it up. I think it's incredibly important that our gymnasts and all of our athletes understand that they have mental health resources. That is something that I address in all of my clinic visits, is I just ask what I think is sort of a simple question that probably all my gymnasts chuckle and laugh at is, how you doing? You having any stress? Just a simple check-in. And, I usually get a nod or I'm fine or I'm good. And I say, well, how's school? Right? Just a casual conversation. School's fine. How are your teachers? They're okay. And I say, how's gymnastics? It's okay. How's competition season? Not so great, right? And that's when it starts, right? And so just having that friendly, open conversation, we're not asking any scary questions, but just kind of inquiring to say, how is your mental health? How is your stress level? Because I do think that plays a huge role in injuries and injury prevention. So I'm asking every kid if they're stressed, kind of diving a little bit softly into it. And then also giving the recommendation that we have a great mental health team at Boston Children's. And so I am constantly making that referral to them, and I'm explaining what they do. And actually what I've been really impressed on over these past few years, I would say post-COVID years, if you will, and even I think post-Tokyo Olympics,
Yep.
that we have seen a huge push for mental health, which is amazing. And a lot of my athletes now are coming in and they say, well, I already talked to somebody. What are you talking about? And that to me is so rewarding because it means they're buying into it. They're understanding the importance of managing their stress. I also like to give the example to my athletes. If you have a big test and you are standing on the next day, and you're standing on your balance beam about to do what's called your series, so flipping 2 times in a row. Are you thinking about making sure your hips are square, your core is tight, you're doing your series on the beam? Or are you thinking about your math test and how you forgot to study that one question that you know is going to be on your exam? And how do you think that series on beam is going to go? And that's when I get that little smile, that little chuckle, saying, oh, now I understand how stress is involved. And so I think just kind of casually introducing it, giving a scenario that's sports specific, that they can understand, helps address that barrier to approaching mental health, and working with our athletes with a mental health provider. So I tell everyone that we have a great team at Boston Children's, and there's great teams at other hospitals and facilities too, but I always want to make sure they know they have that resource.
Yeah, that's fantastic. I think a lot of kids don't realize, or young athletes don't realize what's available to them, and especially the mental health piece. A lot of those kids try to hold things in, they internalize it, and
Yep.
it's knowing them and what they are going through to help them. A quick story: I had an athlete a week ago that came in, and she's trying to go to play Division I soccer in college, and she's going to all these ID camps. And it was after a weekend. It was 2 weekends ago. She comes in on Monday, and it was like 2:30 in the afternoon, and she comes and sits down. She's like, "My legs are killing me," and I'm like, "Well, what are you doing?" She's like, well, I was in Florida last week. I was in Virginia the week before. I had to go to Colorado. I got home at 4:00 in the morning this morning. And she basically broke down in my office. And I said, listen, I go, why are you doing this? And she's like, well, I have to, these coaches want to see me. I go, well, they can see you. You don't have to go to all these ID camps. I get it. I know you want to do this, but look what's happening to you. You're coming into school. You're feeling like you're breaking down physically, mentally. We're seeing it. Like, we need to make sure we correct this. So we had a nice long conversation about it. And then she came back the next day and she was like, oh, I feel better today. Kind of took her a day, but to see that with young athletes, it's if somebody doesn't know and see the cues, you want to make sure that you're doing the right thing for them. And part of our job, as athlete trainers, we're wear every hat possible.
Yep.
So it's our ability to be able to pick those things out and try to make sure the athlete trusts us to be able to tell us, so then we can direct them to the right provider. Right.
Correct.
So that's important. I know Children's has a fantastic group.
Yeah.
I've talked to Dr. Mean about it. I've, used a few of the people that are over there for some of our athletes trying to get their self back on the field post injury. And you guys are definitely top notch over there. It's great.
Yeah, I'm incredibly lucky. I tell everyone that I'm not sure my model would exist anywhere else, but I'm able to refer, same day to mental health, same day to sports nutrition. If unfortunately they need surgery, I got a surgeon I can call within a second there. So I feel incredibly fortunate to be in my system.
So for some clinicians that may not specialize in gymnastics, what are the key things that they should understand about caring for those type of athletes? Maybe 1 or 2 things you might give them as like a little tool in their toolbox.
Yeah. So I think first identifying that gymnast risk. I think that's one of the biggest things. So those gymnastic specific injuries. There's a few more I touch upon briefly, like elbow OCD or osteochondritis dissecans. There's also something called grip lock, which is where you're doing a skill on a bar with a grip on your hand and the grip gets stuck or locked. And unfortunately, the athlete keeps rotating around the event, causing a distal forearm fracture. So I think being aware of some of those, being aware of a spondy as well. In general, of course, OCD or osteochondritis dissecans can also occur in the knee and the ankle. You, of course, have your repetitive overuse of Osgood Schlatter's, Sinden Larson Johansson's, Sievers. But I think really the big ones that are what I would call very gymnastic specific would be the spondy, gymnast wrist, elbow OCD, and grip lock. So thinking of kind of those as like a provider, understanding them if you haven't heard those terms before, just taking some time to familiarize yourself with those. In general, too, I think it's important to always ask how many hours they're practicing. And understanding a little bit of a level system. So of course, level 1 is an easier level. Level 10 is the hardest level. Elite gymnastics is even above that. So thinking of those level systems is important. I also think it's really great just to read a couple of the sort of literature reviews on gymnastics injuries. So to sort of say there was a paper that I had written actually with Dr. Bay and Dr. Bauer that was all about upper extremity injuries of gymnastics and return to play protocols through the paper Jay Posna. So that was a great sort of overview. And there's actually a video that's attached to it that explains basic gymnastic skills. So I actually have all of our fellows and students who rotate with me read that paper, watch the video. It's only about 10 minutes long, just to familiarize yourself just with some of the terms that you might hear these athletes say. And really, to me, I think that goes quite a long way to be able to say, oh, you're a level 10. That's a higher level athlete. Or even be able to say, hey, I watched a video that showed me what a back handspring was. I think I have an idea of it. And also as a clinician, if you don't understand it, is saying, hey, do you have a video showing me that skill? Because as clinicians, we can understand the biomechanics of movement just by watching something. So I think just showing an interest in the sport of gymnastics is also really helpful. And I think the other thing too is some people still think that gymnastics is only for those young athletes. So we think of the 16-year-old at the Olympics. The sport is changing, it's evolving. We're actually seeing older athletes. In this past Olympics, we actually had average ages of 19 years and older, which is fantastic. So I do think understanding that the sport is changing, it's evolving, would be important as a clinician. And then lastly, I think I have to touch upon our unfortunate history that came out back in 2016 of sexual abuse and the scandal with a previous team physician that we had. So I think also just being sensitive to those issues and understanding that it is a mostly female sport. And with that, just being aware of also RED-S and relative energy deficiency, and understanding too that if you are a male provider, I would just make sure there is maybe a female in the room with you, whether that's an athletic trainer, whether that's a PA, a mom, a dad, just doing any exam on a young female in sort of a more sensitive area. Having another clinician or adult with you is just protection for yourself. And even I'll do it as a female provider as well, as ask mom to make sure she stays in the room, because I think we need to be sensitive to those issues in the past in our sport and what has happened.
Yeah, I mean, well said. And I've always said you have to make sure you're protecting yourself, but also protecting the athlete. My office over at Weston, I have 2 doors in and out. Those are always open. It looks like I'm in a fishbowl because I have windows. Everybody can see what's going on. There's no curtains. There's no blinds. It's wide open. And that just is to protect me, but also to make sure the athlete feels comfortable.
Yep, exactly.
That was well said. All right. You ready for the lightning round?
I'm ready. All stretched out.
All right, here we go. Most underrated injury prevention exercise for gymnasts.
Ooh, oh man. This is a tough one. This is I know it's supposed to be a lightning round, but this is hard. This is hard. I would say, I think people are going to laugh about my answer, but I would say actually a dead bug, but making sure that they are breathing and activating their deep core. So there's your answer there.
Love it. I had a kid doing one yesterday, and he could get through 5 reps, and that was it.
Right. Yep, exactly. Right.
He's going to explode.
Exactly.
Great exercise. Favorite event to watch in gymnastics?
Ooh, I would say the floor exercise. It's just so much fun. Lots of personality, explosivity. I love it.
I think that as well. My wife is a huge gymnastics fan, like especially Olympics, and I just loved watching Simone Biles on the floor. Yes. It's like the 4th of July. She's like a firecracker. She's all over the place.
Yes.
It's bananas how high she can get.
It is crazy. And to be there in person and sit at eye level with the floor, I swear she goes 5 times higher than on TV, what you guys see. So it's crazy.
A book, podcast, or resource you recommend for clinicians?
Ooh, one of my colleagues actually at Colorado Children's wrote a book on gymnastics medicine and injuries. It's called Gymnastics Medicine. So I would say that's a great resource. Also, too, I did start a nonprofit called Gymnastics Medicine Education and Research. So if you head to gymnasticsmedicine.org, there is so much information on gymnastics injuries, research papers, articles, and other podcasts on gymnastics medicine. So I would say either of those 2 resources are great.
Awesome. We'll also share that in our show notes. Coffee or tea before clinic?
I'm actually neither. I don't usually have any of that.
I was thinking the same thing. She's going to come up and say water. One myth about gymnastics injuries you'd like to debunk?
Let's see. I think one sort of injury, but more related to RED-S actually, would be that sort of gymnasts don't get their period. So we're going to debunk that. That is not true. A gymnast who's not getting their period should be seen by a clinician. By the age of 15, a regular menstrual cycle should be occurring, meaning roughly every 26 to 32 days, lasting roughly 5 to 7 days. If that is not happening for your athletes, and if you are a sports medicine provider and you are not asking about periods, you should be asking about it because RED-S, relative energy deficiency in sport, is something we need to be investigating to help our athletes not only now, but also in the future as well.
Fantastic. Most impressive thing you've seen a gymnast do?
Ooh, I mean, I got to go to the GOAT, Simone Biles. Like everything she does is amazing. I'm going to be honest with you. She did a Yurchenko double pike. So meaning she flipped through the air twice on vault, which men sometimes can't even do. Between that or the triple double, meaning she flipped twice and twisted 3 times in the air on floor. I don't know which one is more impressive, but between those two, it is just, she is a phenomenal athlete. Oh my goodness. She truly once in a lifetime, the GOAT of gymnastics for sure.
Yep, pretty amazing. Last one, here we go. Advice to young clinicians that are interested in gymnastics medicine.
Yeah, really good question. Best advice is reach out to people who are already doing it. Talk to your mentors, ask questions, ask to shadow, ask to learn, go to lectures, listen to these types of podcasts. Just keep getting all of the knowledge. There's room for everyone in gymnastics medicine. It is truly just starting. It's growing. It's developing. If anyone ever wants to come hang in clinic with me, you are more than welcome to shadow. You have to be 18 and above, of course. But from that perspective, reach out anytime. But definitely just keep learning, keep evolving, and keep asking questions.
Elly, this was amazing. I truly appreciate you coming on today. I am so excited to get this out to our listeners and our viewers. I couldn't ask for a better interview. I appreciate it. Thank you again.
Yeah, thank you so much for having me. I really enjoyed being on here. This is truly one of my passions, and I hope that we can make the sport of gymnastics safer for everyone involved.
Awesome. Thanks again.
Thank you.
Thanks for listening to Behind the Sports Medicine Podcast. Follow us on social media and check out our website.
The information shared on this podcast is for educational and informational purposes only and is not intended as medical advice. Please consult a licensed healthcare provider for guidance related to your specific situation. We'll see you next week.